Even though COVID cases are rising, state lawmakers are expected to vote next week on a measure that could lead to the end of the state's public health emergency. But the proposal goes farther than Governor Eric Holcomb wanted. And critics say it could make Indiana unhealthier. Republican lawmakers added language into the draft proposal that would restrict private businesses in the state from mandating their employees get vaccinated. It would require businesses to honor any request for a religious or medical exemption, including for pregnancy and anticipated pregnancy. A hearing on the measure lasted 7 hours on Tuesday. Doctors and business groups were among those blasting the proposal. They say companies should have the right to make their own decisions about workplace safety. But supporters of the measure included some witnesses who pushed misinformation about the safety of vaccines, and some say their individual freedom matters more.
I, as an employee, have rights. And those rights are some of the most closely held American rights, and that is my religion and my health. So that balance we have now between the business's right and the individual's right come to what you see in this bill.
I'd like to know what is the date upon which the pandemic is going to end? Because otherwise, it's my understanding that if, quite frankly, the timing stinks. The COVID numbers are going up in the state of Indiana, including those of children.
The full state House and Senate are scheduled to vote on the measure as soon as next Monday. So here's a look at what Governor Eric Holcomb is asking for. He wants lawmakers to expand the range of people who are authorized to give COVID vaccines in the state. He also wants changes to the law so that Indiana does not lose hundreds of millions of dollars in federal Medicaid and food stamp money if the state's public health emergency ends. The governor has said he does not support the vaccine limits in the proposal, but he has not said whether he would veto the bill if it passes.